Hello, everybody. This is Dr. Sara, and today we have an FMG aspirant who has now become a doctor, clearing the Jan 2025 examination. We have Dr. Jaisri. Congratulations, Doc. We are so proud to see you.
Thank you so much, ma'am.
Can you please explain? Yeah, can you please explain to me how are you
Oh,
feeling
I'm
right
feeling
now?
so excited, ma'am. My parents are so proud of me right now. Like, I'm the first doc in all the generations, in my relatives also. So, everyone is so happy. I
Oh
made the
my God.
dream come true, actually. Everyone is so
Uh,
proud of me right now.
No, that did. I think you did the best that you could for them. This is an amazing feeling.
And
So
everything is because
let's.
of Arise team. I'm saying, also, you also, ma'am. Every time, if you want anything help, I have seen like anything, Sarah ma'am means you will come and say, you used to help every one of us, like without even hesitating a 1 minute also.
Thank you so much for attending that. Before we go forward, let's get a basic introduction about you. Can you tell us more
Okay.
about you from the beginning till the end?
Yes, ma'am. From the beginning, nothing much more about me, ma'am. Actually, I'm from a middle class family. Mostly, my parents want me to do MBBS here, but at the time, I was not knowing that it is a big issue going abroad and doing. I felt like okay, I'll go abroad, enjoy, and do my MBBS there. Now, even FMG is INS at a neat level, so it is nothing differentiate between these exams now.
Like you said, where did you go? Where did you do your university? Tell us your
Yes,
mark, your
I
name.
did it from Kazakh, ma'am.
Hmm.
Al-Farabi Kazakh National University it is.
Hmm.
So first we are not knowing about Arise, and we got a like senior from who did from Arise. He came and said us about Arise and all. So I was thinking to join, but again after coming back to home because of some issues, family issues, I was not coming to Hyderabad. I'm from Vijayawada, from Andhra Pradesh. So I was not unable to travel to Hyderabad, and I was thinking, okay, I'll do some. And my friend called me. He's from offline. He joined Arise, listening to
Hmm.
senior. Actually, I was thinking, we all thinking as a batch we'll join Arise, but I couldn't make it. Now again, he called me and said, I was like, okay, let me take online from Arise. No, for genuinely, I'm saying first, I think, okay, this is also PR. Like we know, like platform will be PR and all, but genuinely now I'm saying after experiencing, no, Arise is like a family. Like I saw how teachers want us to pass and go from this big thing. I know how much big thing this is. Like I see the pass percentage also only 30% got passed this time, but this is the highest one from the last three sections. This is the highest. But I have seen teachers, I have seen you and Khalils are also, oh my god, you teachers are so amazing. You 50%, I have to give 50% you, 30% my hard work, 10% my family, God's grace and everything for all these things, and 10% is luck. You guys are
Really?
like pillars. I have to say, I can't even thank you. I texted every teacher personally, like, oh my god, thank you, teachers.
No, no, I saw that. You are amazing. And please tell us, like, you studied for 6 months, right?
Yes.
So when you were giving the exam, like, even though the percentage is so good, students were saying that the paper one is so tough. So how was it different, Doc? How did you approach it?
Actually, ma'am, if we talk about the papers, paper one is like tough, but PYQs are also included in paper one. Questions are like okay, small, but paper two is like familiar paper, like subject surgery and all came, obs and all. But questions are large, very large. Want to say is time managing, doc, because when I'm doing GTs from home, it is like oh my god, it is taking so much time and all. But when I was in exam hall, 5 hours felt like 5 minutes. Literally, I was not even accounting to time, because reading questions and understanding them, time is going off. It is so different. Exam atmosphere is so different, and doing GTs at home is very different. But the thing is, we have to do continuously because that practice helps in the exam. That I came to know. And PYQs are most helpful in this time because 30% is hard paper. We also like surgery because neat questions directly came. And I said directly came. Even silly mistakes I made. I was like, okay, I came home. I was like, this thing I want to say because in that pressure, okay, we have to get 150 marks. Because of that, we are going to change. I changed. I changed so many questions. Or else I counted. I used to get 200 and above, but yeah. But at least I passed. I came
No.
home and I cried with my mom. Like, I changed so many questions. Knowing I changed, I don't know that pressure, exam pressure is so high, doctor. Like we have to cope up with that. Now I really experience like it is totally different world when coming to exam and giving GTs at home. Totally different thing it is.
Was GT giving GTs helpful, like to your
Yes,
juniors, to advise
yes.
them give
I
GTs?
I will advise everyone like 100%. GTs are the main thing. GTs are the thing you are helping. I will say, my friends, that few people are there actually from Arise also, from others also. They didn't give GTs that much. They directly gave exam and couldn't make it. Even people used to text me like, Jaisri giving GTs, we are getting low marks, so we don't want to give GTs. I used to say only one thing. See, if you are fighting a war, you have to practice every day. You can't directly go and fight a war like that. This is a big war, like mentally and physically also. You have to sit there, think mentally. Without practicing every day, without thinking every day, directly you can't go and gain marks there. But also, we can't be consistent every day. Few days we will be so low, few days will be so high, and we are very low. You will come, ma'am, with the video. Guys, you have to do it. Every time I increased, okay. I was like, okay, ma'am. So yeah, when you're so low, okay, open a video just for fun or something, or you can go and sleep. Even Sandeep sir also says you have to cope up with this, or else you have to take rest. Even surgery sir also say this thing. So yeah, please take rest. You have to relax your brain for some time. If you're not understanding anything, just close the book. Meditate like something, do something for 1 to 3 hours. Even if I open Insta, I just go for PYQs or questions, everything they post. Even Salman sir also post the questions and all. I just go for questions and come. That's it. Like in third month, I think so. Oh my god, I have to do in my first attempt because it is so much pain to sit in one place. Like this is my desk. Here only I'm sitting again right now also. My desk, my chair. Morning till night. I was used to sit here only 6 months, not going out also. I didn't even see sunlight, like not going out and anything.
Like you said, there are a lot of highs and lows in the exam. You have days when you're motivated, then you have days where you're going low. So for those days, what did you do? And what would you advise your juniors who are going to appear in the June or July examination?
Yes, ma'am. I want to say few things that if you're low, just see some motivation video. If you can get motivated from it, or just think what in your situation you're in right now, what situation you're in. Like you have to get out from the situation. You yourself is responsible for your life, and we are grown up right now.
I still remember, like, even with me, I think I always tell myself action precedes mood. You do something, your mood will automatically get better.
Yes, ma'am. Even okay, you're bored. Like books also, you're so bored. Just go to Insta. So many like they keep pics and questions. If you're doing one question wrong, oh my god, I got one question wrong. Now next question I have to do correct. Like that motivation also will build up inside you.
What about group study? What do you think? Is group study more beneficial or studying alone?
Actually, this is my personal. I faced this group study. Group study is not for everyone, ma'am. Group study means you have to have friends, real friends, like who are really wanted to do. I felt in this loop. I am saying genuinely, I felt in this loop without thinking once, and I started a group study, but it didn't happen. If I want any help, I will. I have a board. I will show, ma'am.
Oh, I'm so proud of you.
So this is the board, ma'am. I
Oh,
just draw
wow.
myself and I explain myself. So wherever I stuck, somewhere if I stuck, I'll just draw that and even sickle cell anemia thing. I'll draw for 2 months. I was like, what is this at first? Then I was like, okay, I simplified it. Even I explained that to other students also. When I simplify myself, I explain other students also.
If you could go back right now and meet the 6 months old Jaisri, what will you advise her to do? What do you tell her not to do?
Not to do is that don't get too leisure, I'll say, because few things happen in life, like some problems will happen. It is not like normal, but because of some problems I stopped studying. Like yeah, for few days like that I stopped studying. Somewhere in my mind I know that I am going to achieve, so I'm not so much considered about the past, JC, because from the day one I'm so eager. I have to crack this exam. I have to continue my life. I have a family. Now I have to take responsible of that. So my family is the backbone for my motivation and everything.
You joined a Rise Online batch. So did the FTR, the TNDs, the QRP session that was taken,
Yes,
were
ma'am.
they helpful for you?
Yeah, so much. Actually, I'm totally relied on Arise, ma'am. All those are so much helpful, ma'am. GTs, question banks. When class is over, we used to go to question banks. We used to do regularly question banks. After question bank period over, we used PYQs are added in the Arise. I used to do PYQs also. Even going to exam in, I got Hyderabad center. So when I'm traveling in middle, I'm doing PYQs and going. So yes, ma'am. PYQs are so helpful. They added in the question bank, and also FTRs, quick rapid revisions, TNDs. Everything is so helpful, ma'am. And the recorded
How?
sections
Like,
are also
can you tell
available.
me how did it help you? Did it come in the
Because,
exam?
yeah, because we are not like robots to scan 100% information. Obviously, we will forget. If it's read today, I read someone topic. In that 30%, I will remember without revision. 30 to 20% I can remember without revision. But again, if we revise, okay, some 60%. But when we are doing questions, questions are interlinked. Like we know integrated questions are coming. So we have to interlink to one topic to another topic. That is helpful in TND discussion or in doing questions. So because of that, I increase my concepts also.
Yeah, that's amazing.
Yes,
What about
ma'am.
the quick rapid revision? You were there attending those 6 days.
Yes, yes, ma'am. I was there attending, and also I rewatched the videos also. These quick rapid revisions are like people who couldn't do all revisions, like because it is 19 subjects. Obviously, people will miss some revisions. It is not possible. Small subjects, if you go to quick rapid revision, also it is so beneficial because point to point topics are there, which are very important. And also, if long videos are like long subjects are there, like patho or medicine, everything, half you studied, half you revised, another half also you can go to quick rapid revisions, ma'am. Even I did for or then all this quick rapid revisions on. Even surgery, even pathology, everything I saw, and again I read all the PDF. And your PDF is so amazing, ma'am, actually. And you added every like INA set questions, neat questions, everything like line wise.
No,
After
the
each
last.
topic it is, yes. It is so good,
Actually,
ma'am.
every faculty did that.
Yes, yes,
We
every faculty did. Even ops and gynae ma'am also did it.
so they were more like, we'll take it.
They are hardworking people, but the content they get abroad is less compared to India. The knowledge, like it is content information is less information. So coming here, they are like bare hands to say. Now after joining Arise, we are like feeded so much. We are so full of hands right now. Even now, I can go and teach someone. I'm in that position right now, actually, to say there is some guidance and hard work. Everything will be successful.
How many mock tests did you give?
Like GTs, I give 10 to 12, ma'am, or maybe
10
more.
to
I
12.
think so. Yes, because I started in November. I used to give every week one mock GTs. I used to give, if possible, two. I used to give. After coming again in Arise also, and we have so many GTs. Four to five mock tests we used to have, and everything it accounts for 15 mock tests something, ma'am. I remember like okay, these things will happen in exam, but after results came, I was like, oh wow, I did good actually because of that revision and practice and GTs only.
Did you review the GTs when you gave
Yes,
them?
yes, obviously, ma'am. I used to review the GTs. You also said, Khalil sir also said, you guys, after giving GTs, you have to review. I was like, okay. But it is hard, ma'am. I'm saying, na, after giving GT, because GT is 3 hours, like, okay, 5 hours it takes to give GT. How fast we did also? 3 hours it will take. After giving that much time, my head is going to ache so much. Okay, I was like, yeah, I can't do. But again, I used to hear your voices. Guys, you have to review the GTs. I was like, okay. I will go and review all the questions. So where I did mistake or what question I was not familiar with, I used to review them.
Do you want to thank anyone, or do you remember instances from class?
Ma'am, I want to thank each and every teacher, ma'am. Even I said you, especially when we need you, you are like, "Oh, yeah, guys, I'm coming. And you used to do all, you used to respond in minutes and seconds also. Even Kalyan sir also. You guys are such a very helpful for us. You are the pillars, I'm saying now. Every teacher is a pillar. PJ sir, he scheduled and he said like, guys, do the revision like this, and I followed his revision like 2 to 3 times, 4 to 5 times, like that. Salman sirs, oh my god, amazing teacher, amazing pharmacology, amazing microbiology. Like my, I have these big books of writing pharmacology, but I couldn't remember anything. But from his, like his all mnemonics and all, oh my god, now I remember everything. Yeah, all teachers are amazing, ma'am. I have to now name every teacher, Sandeep sir. Every teacher is amazing. I can't say one teacher. And I want to say, FMGE is not about 12 subjects. It is not about 10 subjects. It is totally 19. And you say one more subject is English. It's 20 subjects, as you say. You should not just go, okay, I will do 12 subjects and I'll leave other subjects aside. You should never do that thing, ma'am. Because you don't know now. Last paper, ENT, Opta, these questions are so high. Obs and Gynae, these questions are more. Actually, volume questions came from these subjects. And ortho, only 2 to 3 questions came. So anything can change. That people can change anything. Like they can decrease some questions, they can increase some questions. So we can't just like keep our hopes. Okay, I'll just study PSM surgery and go. I'll get marks. You won't get like that, man. You have to focus on 19 subjects, but 12 subjects you should be 100% sure. But all subjects you have to do.
Yes. I just want to ask you two last questions, okay?
Okay, ma'am.
First, describe a day in your life as an FMG aspirant.
As nothing, ma'am. I just get up.
Not
What?
now, like when you were
Yes,
preparing
yes, when I'm
the whole
preparing.
day.
Whole day. Just wash up, come sit 4 o'clock, 5 o'clock, 6 o'clock, anytime come sit your morning. Study. Do GTs, do tests, do MCQs. Sometimes it used to be 2 o'clock at night. If you're tired, go back, sleep. Wake up again, same routine. Yes, I used to not eat also. Just coffee or something like just drink. That's it to keep my energy. But this is like a challenging for me, and I'm proud that I overcame that challenge and I make my family proud.
How many questions did you do every day?
Like
Like,
every
did
day,
you have a target?
I yeah, more than 100, ma'am. I used to not keep count, but I am pretty sure it is more than 100. Sometimes I have to, GTs also like regularly I used to give before also. After coming like 1 week I used to give, and sometimes it will be 150 questions also. Whenever I'm bored, I used to go to Instagram. I said no, ma'am. I used to go to Instagram. How many questions I see, that many questions I used to do and come. If I'm bored, if I'm not studying any day, I just go and do some questions and come.
I want to ask you, was it like no many people say offline is better, online. What is your opinion about that?
Yes, ma'am. Even some people message me, what is online, what is offline. I want to say nothing, ma'am. Offline, online, we'll keep aside. The thing is, online, yeah, they're having pros and cons. Online means you can be relaxed. Video is playing, you can sit however you want. You can sleep and see. It is their wish. But offline, you have to sit. But in live interaction will be there. Online, you can ask direct questions in the charts, and you guys every time you reply, like how many questions comes, that many replies you will get back. The thing is, ma'am, I don't feel any different between online and offline. Just the stay. Home, it is like comfortable and everything will be available. You can sit at one place from morning till night. You can do. No one is going to disturb you.
Thank you so much, Doc. This was such a nice interview, actually. I had so much
Thank you,
fun
ma'am.
with you. And seeing you from the online batch, coming as an FMG aspirant, and now as a doctor, as a colleague, actually, it's truly amazing. This is a
Thank you,
very
ma'am.